I would like to welcome everybody to the XpanDH webinar on the use of European electronic health record exchange format ecosystem. This is our fifth webinar with distinguished experts. We'll provide updates through the case studies and the best practice for the European electronic health record exchange format in their countries. And today we are going to let me start my video. We're going to start from the experience of our colleagues from Austria, and we like to invite Dr. Helene Prenner, program and project manager for ELGA, and they're going to give a joint presentation with Manuel Helm, who is the head of eHealth standards in ELGA. And let me say a few words about Helena, who is also working in the extended EHR joint action. She holds a pivotal role in the driving force behind the several European projects, specifically focused on implementing My Health at EU services in Austria. And as an accomplished professional with a background on European health economics and management, her mission is to propel the healthcare industry forward by harnessing the power of data. In addition to her role as ELGA, Helen is a board member of the Data Intelligence Offensive, where she plays a crucial part in advancing Austria's healthcare sector into a data-driven era. As a key player in shaping the future of the industry, Helene's work is instrumental in advancing Austria's healthcare sector. And a few words about Emmanuel, who also serves in the eHealth standards at ELGA, the Austrian Digital Health Authority. Leading a specialized team, he oversees the development and maintenance of implementation guides vital for establishing content standards in Austria's electronic health record system. He has a PhD in computer science and a master in biomedical informatics from the Hagen campus in Austria. Helm boasts over a decade of expertise in healthcare informatics. His background includes roles as a lecturer, researcher, and project manager at esteemed institutions like the Frankfurt Oberhard in FH in Bolton. Helm's dedication to advancing digital healthcare is evident through his involvement as a board member of TC co-chair at ICOM User Group Austria, where he actively shapes industry standards and promotes collaboration with the healthcare community. Please begin your presentation, and thank you for accepting this role.
Helene?
Helene, please.
Perfect. I think now I'm speaking. Perfect. Thank you so much, Christos, for introducing us for such a long time. We'll try to keep it concise with only like 10 minutes to give you a brief idea about where we are at in Austria with our system, our electronic health record system of ELGA, and our current national developments around European exchange formats. What you can see here on the slides is first on the top part, the national implementation and where we are at. As most of you know, our electronic health record is of course based on international standards as HL7 and IHE, and we have been up and running since 2015, so we do have quite a history within Austria. On a national level, we started off with the e-reports. By now we have approximately 80 million documents in, and you can see here also the percentage of which e-reports are stored in ELGA by now. So we have more than 50% are laboratory results, around 26% are imaging reports, and 16% are discharge letters. And what's also very important for us in Austria is, of course, our e-prescription, e-dispensation system on a national level. That's called the e-medication system. That's up and running since 2018. And the e-vaccination is up and running since 2020. So all of that, what you can see here, is basically our national implementation. And as a lot of you might be familiar with, is that ELGA has been very much involved in European projects at the very start of ELGA. So we've been playing a crucial part in APSOS, but then we never connected to the EHDSI world up until the projects that we're at right now. And you all are probably quite familiar with the current developments around the European health data space and the importance for the European exchange formats. So what you can see here on the bottom part is MyHealth.eu and our current projects that we're involved with. The one project is called ATE EHDSI, so Austria connecting to the EHDSI infrastructure. And we're going to go live with e-prescription and e-dispensation services first, country A and B use case. And this is all going to happen this year already. And the next projects, I'm going to go into detail with that with the next slides. But what I want to mention here as well is the extended EHR project that Chris has already mentioned. This is where we are also playing an active part to push Europe's exchange formats forward. So this is what we are doing and what we are currently involved with. You can see here probably a slide that you might be familiar with as well. You can see at the very top the EHDS negotiations that are currently going on, but there was a very nice turning point last Friday. And the first two services that are going to be obligatory for all the countries to have patient summary and e-prescription services are gonna start soon to be in the transitional period. And that's why we very much use this capacity building phases coming from the Commission to also get ready within our national infrastructure. Next slide, please. So now what you can see here is the whole timeline of many European countries, and finally also Austria chiming in with 2024, as I mentioned, with the e-prescription service. On the bottom, you can see the patient summary service, one of the first principal categories for building the EHRF. And patient summary, as you can see here, is still pending. We don't have a patient summary up until now in Austria for national use. So this is why we're still a bit struggling with building that. But if you go to the next slide, you will see our current project that we're involved with. I already mentioned the e-prescription and e-dispensation part. What is our core central goal here is to really establish the national contact point for eHealth and the basic infrastructure, including, of course, the standard that is required to join in. And we're going to go live with the country A and B use case if all the tests go well. We're currently starting or in the middle of a test session, actually. And you can also see all the organizations that are involved with it. And if you go to the next slide, you can see the newest project that I was mentioning before, also around the patient summary. So what we were putting down in our last proposal was that we're also going to start with a patient summary as a country B use case, as this is one of the primary goals to establish that service also in Austria. And we're gonna have an implementation concept coming up for the national as well as the cross-border use for Austrians. But most relevantly, we're gonna really start the HL7 fire journey with lab results in country A and B. You can see here the project duration. It just started this February and it's going to continue until January 2027. So this is what we're focusing on right now. And also, and that's quite interesting for us, is of course also the hospital discharge letters. We're going to try to also implement that as a country B if we find other European countries to test with us. So this is our goals. And if you then go to the next slide, I'm gonna now give over to my colleague, Emmanuel, who is gonna tell you more about the medical images last service still missing for you to have an understanding where Austria is gonna head with the European exchange formats.
That's more of an example. Thank you, Helene. More of an example of how we approach the harmonization of these guidelines with our national guidelines. We try to, at the very early stage, understand what new recommendations and new standards and adoptions are going to be used in the European context. This is one example of the IHE multi-country working group's recommendation on imaging study manifest and sharing imaging information. And if you go to the next slide, please, you can see that we consulted our national standardization organization affiliates like the DICOM user group Austria or the HL7 Austria, and tried to identify the gaps between what our guidelines, our recommendations are in contrast to upcoming European recommendations. So we try to find the, let's say, the delta and identify what we still have to do in Austria to be able to communicate with the rest of Europe in the future. Thank you.
Okay, thank you, Emmanuel and Helene, for your presentation. Shall we go to the next speaker? Filipe Mealha is a coordinator of the Planning, Architecture, Compliance, Engineering Unit at SPMS and rapporteur to the Technical Interoperability Subgroup of the eHealth network. He, as I said before, Austria and Portugal are one of the main collaborators in the XpanDH joint action. So we'll be very happy to hear their progress in the European exchange format of the national EHR architecture. Please, the floor is yours.
Thank you, Christos, and thank you everyone for having me. It's a real pleasure to be here with you today. So I will be talking to you about our experience with the electronic health record exchange format here in Portugal, focused on the patient summary use case. And so for me to do this, the first thing that I would like to talk with you about is our infrastructure. So how we set up our data sharing infrastructure here in Portugal for this scenario. And if you can skip over to the next slide, please, Chloe. So we are operating under an event-driven architecture, not to get too technical. And to do so, we established many years ago a national interoperability platform, in which we do a lot of transactions between information systems. So, and if you've heard of this expression before, never waste a good crisis, during the COVID pandemic, we ended up setting up a new national infrastructure, which we designated a national index. This was very inspired in the XDF profiles from IHE. So we created this infrastructure, if you can skip over to the next slide, where we set up document structures. So and a document is it's an abstraction of any aggregation of data that is clinically relevant and serves a real world purpose. So an example of a document can be the patient summary, can be the vaccination card, it can be the COVID certificate. So aggregates of data that hold value in real world provision of care. So we have this place where we can set up this conceptual structure of a document. And next slide, you see at any given point in time, we have our national registry sending over metadata to this infrastructure. And so what this does is that in any single point in time, we know in real life that a new event has occurred. Maybe someone got vaccinated, maybe a new allergy was recorded. So a new event is recorded related to a single patient, and this fills up our index. So, and because we know which information makes up a specific document, the next slide, you see when the specific client queries for a document, goes through the index, we know where the information is recorded, and then we fetch that information in real time. And this is what is represented in the next couple of slides. So if you can skip over to the next two ones. So we query the data in real time, we get the data from the national registry, and then we do transformation of this data and we deliver a document to the requesting party. If you can skip over to the next two slides. And in this transaction that you can see on the screen, so querying the actual information and sharing that information and sharing the final form, the document structure of this information is where we are using the electronic health records exchange format. Now guidelines, but soon to be specifications. And so if you go over to the next slide, Chloe, and if we now look into the data layer, semantics layer, in the next slide, you will see that we have first established you can skip over to the next one, please. First, we have started by establishing a set of universal FHIR resources in Portugal. So we created a general set of resources that allow us to exchange information on practitioners, on organizations, on patients, and on information related to scheduling. Because these are essentially the top, well, almost every single healthcare transaction will have at least one of these elements. So, and these underwent a public consultation period, which is now over, and now they are in practical use. And these are resources that are constructed using FHIR and SNOMED. And if you skip to the next slide, for the EHR exchange format, we have just finished two FHIR implementation guides. One is related to the sharing of vaccine information, the other one's to allergies and intolerances. So, and these two implementation guides, they are based on the International Patient Summary specifications, and they are compliant with the eHealth.eu guidelines. And we will make them available to a public consultation period in later this month. And once that is concluded, these are the assets, core assets that we will be using to handle some of the transactions that I was telling you about before. So this is more on a technical level, what we are doing right now in accordance to the EHR exchange format. But if you skip to the next slide, other than the technical layer, the semantic and syntactical layer, there is a big dimension that we are also covering, which is the legal, the regulatory dimension. And if you skip over to my final slide, so EHRxF regulation, it's going to be, when approved, it's going to be a very good umbrella regulation, but it will not solve all of our problems nationally. So the EHRxF regulation, it's a market regulation, but it does not create the legal obligation, for instance, for suppliers, for software suppliers, and for healthcare providers to exchange information in a national platform, national infrastructure, where we can certify that all the transactions are secure and that they are trustworthy. So this is something that we are looking into. How can we create the legal framework nationally to make this a possibility? And who should comply with this legal framework? Should we restrict this to software manufacturers, to providers of healthcare services, or to individual healthcare professionals, or to all of them? And if we do so, what are the implications for all of them? Another big thing is we hear this a lot, place the patient at the center of operations. So what I showed you was a very simplified schema of our landscape, but one of the core things that we are working on is patient consent. And of course, patient consent should be required for any transaction to take place. But again, from a legal perspective, this raises a lot of questions. Are there break the glass scenarios? Is consent opt-in or opt-out? So we are working on this nationally. And another big thing for us as a governmental organization is to create the legal mechanisms that allow us to regulate this network of information sharing. And this means that we need to have the instruments required to apply sanctions if anyone misbehaves in the network. And also because SPMS is a procurement agency, maybe there is the possibility to index a certification schema to procurement services. Again, this is something that is being legally revised, and it's going to take up the most part of this year, but it's something that is fundamental if you want to have a fully functioning national information sharing about the patient that accounts for public, private, social healthcare providers. And of course, another challenge is to make this new regulation flexible enough so that we can, with less strong regulations, dictate what accounts as information that is to be shared mandatory at a national level. There are many other challenges. This was just to highlight a few of them, but we tend to focus these discussions a lot, and dutifully so, on the technical side of things, but it's really important to remember ourselves that there are other dimensions that we need all of them to work together if we want to achieve this level of interoperability, both nationally and abroad. Thank you. And finally, my last and most important slide, Chloe, is the one with some of the faces of our teams, which help out to implement this vision. So thank you for having me today, and feel free to ask any questions.
Thank you, Filipe. Yes, you're very lucky having 8 people working for you directly. Let's now move to the next speaker before we start any questions. Let me introduce Kerli, Linna. Pleasure to have you. He's the head of Data Management, Health and Welfare Information Systems Center in Estonia. Of course, semantics interoperability, terminology, and data exchange standards have been her focus for over 10 years now. Starting this journey as data management analyst, and now as the head of the team responsible for implementing healthcare terminology and data exchange standards for the Estonian National Health Information System. She's also being involved with different European projects, and it's been fascinating to see how the EHRxF has evolved and become an implementer and a different level, as she mentioned in her experience journey. Please, Kerli, you can start your presentation. Thank you.
Thank you, Christos. And hello to everyone. It's my pleasure to be here. And now to speak about how we use European EHRx format in Estonia, I would like to start to point out a simple understanding of different layers, how at least we see what the European EHRx format is about. So it's not just one specification or requirements for us, it's different layers, starting with principal rules and requirements for interoperability, and then going down to more flexible space specifications, and ending with more specialized European cross-border specifications for different services that should be implemented cross-border in Europe. And we have to take this all into account when we are also implementing our national solutions in Estonia. And we have been following all these guidelines and requirements for creating our national services. Next slide. So this picture a little bit more explains how we use these requirements and specifications when we implement our national services. So when we create our national services, we take all these into account. What are the requirements or guidelines that we should follow implementing different services? But for European level cross-border service support, we don't ask all the healthcare provider EHR vendors to directly apply these rules to their solutions, but we take these rules back to our national services, that our national level solutions should be implemented this way, that we can map back to the requirements that are meant for the cross-border services, and we transform these documents on the national contact point level. And the next slide picture will explain it more. So we have our national central EHR up and running since 2008, and we have developed many different services on that. And we make and publish national requirements, how and what data should be sent to the central system. And when we create these services, we all the time consider all the rules and requirements that are described for the cross-border service. So, for example, we already have patient summary and e-prescription up and running for the cross-border service. Patient summary since 2022 and e-prescription since 2019. But all of these documents are assembled on the fly by the central system when it is required from the other country that they need a patient summary about one patient from Estonia. And these documents are not sent directly from the healthcare provider EHR systems, but they are assembled by data that we already have in the central system. So for the healthcare provider EHR vendors and healthcare providers themselves, they have different documents that they have to send to the central system. We in total have 28 different documents that are structured and should be sent every time to the central system. And we also take another additional information from different registries that we have in Estonia, and all the patients are able to see all the data from the patient portal the same way as the healthcare providers can see it. Next slide. And this is just a simple overview how we assemble the patient summary for the cross-border service. So behind this one patient summary document that has to be sent across Europe, we have in national level many different documents where the data is coming from. So when the query is made to the central system itself assembles the document based on very many different documents about this patient. And then the document is sent to the European country who acquired this document. And when we implement our national services and create these documents that should be sent to the central system, we all the time need to take into account all the rules that are in the data set of patient summary. So it will be able for us to compose this document and at this level what is needed for the cross-border service. And next slide. And a really simple overview of what we are working on right now. So the biggest challenge for us in Estonia is the decision that we decided to transition from the document-based solutions to the event or data-based solutions. That means that we will not be gathering document-based information to the central system anymore, but break it down more to smaller pieces of data elements. And this is why we do that is that to have the data in the central system more on time. So, for example, if you have a discharge summary, then right now the document is sent to the central system after the case is closed and the person is discharged from the hospital. But actually there are a lot of data documented during the hospital stay, and it can be sent to the central system the same time when it is documented, not only after the person has already left the hospital. And for that, we took FHIR as a base standard since last year. So all the new services and solutions that we are implementing in Estonia are now based on FHIR standard. And we have to also transform all the existing CDA solutions to FHIR. This also means for us that as we have already patient summary and e-prescription up and running for cross-border service, we need to be able to map back from FHIR to CDA on the time when we already have the data collected in a national level as based on FHIR standard. And we are also working on different other topics and solutions where some of them do not have well-structured base since now, and we are creating them from scratch based on FHIR. But for example, laboratory ordering or radiology ordering and results, what are also the next categories for the cross-border service. We already have some up and running services based on CDA, but we are going to structure them again based on FHIR. And we also know that we have lack of structured data about allergies and pregnancy data. So these are our next focuses, what solutions we are developing on national level. Thank you very much. And if you have any questions, I'm pleased to answer them.
Well, thank you, Kerli. I would like to give the floor now to Anderson for some clarifications. And before I do this, of course, I would like to thank Chloe Lefebvre and Anderson for this preparation. And after that, we have some questions to answer. Please, Anderson.
Okay, thank you, Christos. Thank you all the speakers, Filipe, Kerli, Helene, for the great presentation. I just would like to invite also the attendees of the webinar to send the questions on the question and answer chat. So just a little bit down on the screen. So we are great to do it. And now I would like to invite Christos to moderate the discussion and also invite all the speakers to turn on the camera and also participate in this great discussion here. We have about 20 minutes to do the discussion here with the results and the what data was presented and this. And also, again, I would like to have also the participation for the public on the question and answer. Thank you so much. Christos, over to you.
Yes, thank you, Anderson. Well, we haven't had many questions arriving, but it's a general feeling for us watching your presentations that you have quite diverse experiences and levels of experience in implementing the eHealth RDU, and this is a big challenge. Before I ask a personal question, I would like to give a general question to the panelists. What are the main challenges for the broad establishment of the EHRxF in the EU? That's one question. Now you've seen your colleagues experience it. And what do you think would be the best approach to exchange experiences among the member states to support smooth implementation? And before I give an answer, of course, there are the joint actions, there are bilateral agreements there, but beyond these known activities, I would like to see your propositions, please. You can start from Kerli, if you like.
Okay. What are the biggest challenges? I think the biggest challenge, for example, for Estonia is that we already have up and running system for a very long time. So if these new requirements and specifications are coming out, so we have to change already working solutions based on this. So, and making the changes for already adopted services or solutions, it's sometimes much harder to develop something from scratch. So because people are already used to documenting the data this way, and also we have our vendors and developers have already implemented the services and now they have to change them. I think this is the main challenge for us, to keep up with all these requirements that are coming up, how to follow them this way that it is reasonable for us, what services and solutions we are also developing more broader than the services in the categories that are listed in the cross-border or EHTS documents.
Okay, that's interesting. And from Austria, who wants to? Helene?
Yeah, I can actually just add to what Kelly already said. But it's a big challenge if you already implemented something and you basically had like a big project up and running and you did the whole rollout, and then all your vendors in all your country, they just implemented something, and then suddenly there's a new standard coming up and they need to change everything again. So basically this pre-investment that has been done already, that might be a huge challenge for quite advanced systems that have like their services up and running already. But I think it will always be a constant cycle, because whatever new technology is coming up, and we're endeavoring and like looking into and doing the rollouts there, for sure in 5 years there will be the next technology coming up. So I think it's a lot about managing this constant change in some way, and especially for the electronic health records that have been built like the last 10 years basically, all around Europe. They were the vast majority was of course very focused on a national level. Now we have the EHRxF, now we have this whole cross-border focus that's coming in, and I think that this is a lot, and this will affect a lot how projects are designed. It's already having a change in Austria. It has a change on policy levels in Austria, what is funded within our electronic health record. So I think it's a shift of priorities now to also focus on the cross-border use cases, and to also have the shift for like a whole European health union, if you want to put it like that, in terms of data. So this is the huge challenge. I don't think the biggest challenge is the technical implementation per se. It's rather like this whole policy framework that we're building around it, having the logistical frameworks that need to be in line with everything, but then also taking into account the actual market that needs to adapt to all of that, and that
Thank you, Helen.
might need some time. Yeah.
Some new questions come up right now, and I will read them and see. Are the institutions in Austria, Portugal, and Estonia open for cooperation with private companies? How can companies get involved? And this question is asked by Mikhail Remaki. And Anderson can give an answer to this, or you think?
Yes, of course I can. I can also participate, but I I believe that the cooperation between private companies and also the health systems are primordial, because through the specifications, also to the general rules, the member states shall follow some stricter rules. And when you have the participation of private companies in this process to implementation, they can also be aware about the technologies that they need to implement and develop among the systems. And also I see it more from the vendor perspective, because if a vendor are aware about the rules and the format and all the specifications that they need, they will be ahead and can also provide some products from the member states, from others, already accomplishing all the specifications and requirements. So I believe that it is very important. But I also would like to hear from the member states representatives. Filipe, what do you think about, and also all you are invited to answer to.
Yes.
Thank you, Anderson. This is a very relevant question. So, coming from the Portuguese perspective, we are encouraging private vendors to collaborate with us, being a national authority, especially in setting up the standards. This is why we have rounds of public consultation, so as to get all of the interesting parties involved. But I think going even to the last question, how does this relate with what's going on in the European Union? If I put on the hat of a private software company, here's the landscape that I would encounter. So I would go to Portugal, I would like to do my business there. I would see a set of services, a set of interfaces. Ultimately, they will end up in the electronic health record exchange format, but this is how countries manage to send information amongst each other at a very high level. So they have specifically dedicated infrastructures for this. From a vendor's perspective, Portugal will be very different from Estonia. It will be very different from Austria. They are completely different. Maybe you will see HL7 Fire in one side, maybe we'll see CDA on another, maybe we'll see V.3 on another. It doesn't matter. Countries are very, very different when it comes to national implementation. So the electronic record exchange format takes us far, but it will not take us the whole way. And so maybe this needs to be revised. And we've seen such an example in the past, quite recently, with what we did with the COVID certificates. So we changed the way that we looked into interoperability mechanisms at the expense of verifiable credentials. And this took out a lot of stuff from the path to achieving interoperability. But ultimately, I think that, and I feel that the electronic health record exchange format is the right path, it's the right trajectory, but we still need to sort out efficient exchange mechanism. And we need to revise these national interfaces because it's too costly from the vendor's perspective.
Thank you. Thank you, Filipe. I have another question, and maybe you can answer this question. Also, give your perspective in the previous question. How are patients, citizens in general, involved in and informed in the changes in their health systems? This question is asked by Birgit Beyer. Comment on this and also on the previous question. Maybe we can hear from Manuel what you do in Austria, for example.
I will be politically incorrect. So they are not as informed as they should be, not as participant as they should be, and I'm speaking about our national reality. So discussions are still being held on whether specific healthcare professional classes should have access to patient information in our patient portal. This is the completely wrong discussion that we should be having. So it should be completely the other way around. The discussion should be, how can I, as the patient, because the data refer to me, how can I control who accesses my information? So it shouldn't be the government in its all-knowing wisdom to decide if professional A should have the right to access the information or not. It should be the other way around. The control should be on the patient's side, and only on certain exceptions where other rights supersede your right as an individual should the government legislate. This is a big change in the mindset of the legislator, which is, slowly started, slowly burning, but we are not there yet. And the more that people get the collective conscious that they need to worry about this business, the faster we'll get there.
Yeah, well, certainly the new regulation, the European Health Data Space Regulation just being agreed, is securing this right to the citizen. It's mainly for serving the citizen. We appreciate this, of course, but on the other hand, if we want the doctor, professional, to give a responsible opinion, we must expose him to the whole electronic health record of the citizen. Is there a professional right to have it, and in order to give the best possible consultation? So you must find this balance between available data and make him responsible. The more data we give to the professional from the electronic health record, we make it more and more responsible, because there's no way to say, I didn't know. They didn't tell me. it was not written in the piece of paper. So it's a balance, and it was quite fascinating discussions, I think, taken place during the discussion of the European Data Space Regulation. Can I show you that this is the perspective? I have another question, it's a bit technical, from Panagiotis Sava, and this is FHIR, FHIR, and CDA. And the question is reached like this: as we see more countries adopting the FHIR standard, what are the next steps with regards to supporting member states with regards to CDA to FHIR conversion and FHIR to CDA? This is a classical question. I don't know if somebody can answer this question right now. I think it's a yes, I will give you the floor, Emmanuel, but I think we should insist in the eHealth network, the eHealth network level, to pursue on this discussion. It's very fundamental, it's very important, and it's not the initiative of one person or the other. We must insist on that, but I will happily give the floor to Emmanuel to give his opinion.
Thank you very much. Yes, I agree with you that it is very important that we solve this not only on a single use case level, but on a more general level. And there are some approaches that are discussed in different groups. For example, the HL7 Europe, at the beginning of the year, they had a working group meeting where CDA to FHIR was a big topic. And I would say that different implementations will have to or will arise eventually, but the rules how to correctly transform and what kind of transformation you want between CDA and FHIR, these need to be let's say defined on a higher level. So because there are multiple ways to do it, and they will not lead to the same outcome, and we should avoid presenting 7 different ways of doing the same thing.
Good. Can somebody make a comment? Because I know we're running out of time, but in addition to this, I was always puzzled with the international patient summary and the European patient summary. We haven't been able to solve this simple difference, and I don't know, you will agree with me that in order to go one step further and become true international, we must find a solution between this IPS and the European patient summary, are very fundamental. It was just a comment, and I don't know if I can give you all for a couple of minutes, no more, to comment in general terms and also address my question. I see Estonia and Portugal very ahead in implementing the Mealha DU, where Austria, a country that is been pioneer on eHealth. I mean, I was reading about Austria and ELGA since 2015, and now they are telling us that they're going to have the Mealha DU in 2027 or something like that. They are moving this map to the right. It's striking to me. So please take your 2 minutes, and if you can address this as well, please. And I begin with from Kerli. Your 2 minutes, general comment.
I'm not sure if I got the question right, but I will just try to answer, because we already have this available services up and running. We have patient summary and we have e-prescription as a country A and country B on cross-border level working. But we are happy to implement the new services when they're available for implementing. And as I said before, also that all these new 3 use cases or categories that will come into consideration for the next steps on a cross-border level, we already have national developments and implementation done on these areas. And we are also restructuring them as we are going over to FHIR on these services in next years. So it is for us really important to already know as much as possible the requirements for the cross-border service, so we can already consider them when we are implementing our national services. So this is the thing that is important, so we don't have to change again in next years when they come into implementing on a cross-border level.
Good.
Thank you.
Thank you. Please, Helene.
I'll just give the first part of the answer, and Helene will give the second part. To go back to your IPS, EPS, or European Patient Summary question, although many of our challenges are not technical, I think there are a few interesting technical challenges in these patient summary debates. And especially regarding HL7 FHIR or CDA and which FHIR version and IPS and transformation topics. So that's a hard nut to crack. So that's not, I think the discussion is not finished yet. And thus we cannot really say which direction is the correct one. So that's my part. Helene?
And I'll try to answer your question, Christos, because you have been reading about ELGA from like many years ago, and now you only read that we only start to connect to the European infrastructure now. Yeah, that's true, and I think this is just showing how, on a policy level, we're kind of like dependent on exactly those decisions. So as you know, Austria has been very involved in the past to even build like the European infrastructure. And we're very happy that our infrastructure therefore is very much in line. So it's a quite easy job to connect the services now for us. At least we're starting the project, and up until now it's going quite well. And I think with the opportunity that the Commission gave and the European Union to also foster cross-border exchange, I'm happy that Austria is in that game and now very actively pushing out 3 services in only 1 project proposal and trying to catch up very quickly. So yeah, we're happy to be back on that.
Thank you, Helena. Filipe, yeah.
Thank you.
Comment.
Final comment into Emmanuel's point. I would end up on this note. So don't. This is my philosophy. So don't worry about perfect, because it will never be perfect. And you can take FHIR, for example. FHIR is not a silver bullet, as Emmanuel was saying, and take our own example nationally here in Portugal. So we have a fully running My Health at EU patient summary, which uses a mixture of FHIR and CDA. So why am I here on this talk with you today, saying that we are revising things, that we are creating universal resources and stuff like that? So really, this is about the journey and what we want to get from it, what we want to get from the market. So we see the need to change our core FHIR implementation because it has inefficiency, not because this is the ultimate thing that will never be changed again, that it will never be challenged. So we need to revise this because we need to accommodate certain needs to either regulate or provide them. So this is my parting message. At the end of the day, as we are striving to get standards out there, and we are working very hard, being from the European Union perspective or international perspective, life still goes on. So we must, find a balance, as you were saying.
Okay. Thank you, Filipe. I would like to give the floor to Anderson as a general conclusion. And there's a question there from Panagiotis, if you can say something. Please.
Thank you so much, Christos. First of all, I would like to thank you so much for the Christos as the great moderator, and also all the speakers for the great opinion, because this is very important. We needed to align efforts towards to a common goal to implement the electronic health record and have a true interoperability among the health system. Also supporting the patients and others. In XpanDH, we have so many initiatives as the XNet and also community doers that try to listen to the patients and health professionals as the main users of the formats to give their opinion about what should be present in the formats in the systems and the other points. So it's very important. Also, thank you all the speakers and the participants here. I would like just to announce our next webinar that will be held on the 23rd of April about digital health as cancer care facilitator, promises from the standardized European health record. So please just scan the QR code and do the subscription in this very interesting webinar that takes basically a small part of the patient summary and how we can address it and use the case specifically for cancer patients. So as the last word, as the coordination of the XpanDH, thank you so much for attending the meeting, and also for all the speakers and the moderator to participate here. And also I would like to invite you for the next webinar that I present here, and also the series of the webinar for XpanDH that will be held more or less in May. So be attending our social media and our other communications, and it's it. Thank you so much. See you on the next webinar. Bye-bye.
Bye, everybody.
Bye-bye. Thank you.
Bye. Thank you.